Okay, it is 6:05. Let's go ahead and get started. Thank you to the Physician Planning Group for joining us here tonight. The Physician Planning Group is a financial services firm that works with physicians and healthcare professionals, helping them navigate through student loan management, protection planning, wealth management, retirement, estate planning, and everything in between. Our advisors are annually featured lecturers at Renaissance School of Medicine at Stony Brook, NYIT College of Medicine, Albert Einstein College of Medicine, Zucker School of Medicine at Hofstra Northwell. Tonight, joining us, we have Deanna Filosa, CLU CHFC, Managing Partner and Financial Advisor. Deanna Filosa has been diagnosing and prescribing financial strategies for physicians for over 30 years. She's helped hundreds of residents and fellows transform from financial newbies living paycheck to paycheck to confident, debt-free, financially independent physicians. Deanna serves on an advisory board for a Fortune 100 financial services company. Her leadership roles have included Chair of Diversity, Equity and Inclusion, improving the client experience and disability income insurance product design. Deanna has a Bachelor of Science in Industrial Engineering from Rutgers University. She also holds the Series 7 and 63 licenses, along with the following designations: Chartered Financial Consultant, Chartered Life Underwriter, and Special Care Planner, designations from the American College. Seth Smith, Student Loan Specialist and Financial Advisor. Seth provides PPG clients with debt management, insurance, investment, and retirement income solutions in concert with our philosophy and commitment to building and protecting wealth. As the spouse of a physician, Seth understands firsthand the intricacies of student loan management and successfully moving through the PSLF process. Seth holds his FINRA Series 7 and 63 licenses. He is a native of Oakland, California, graduated from the University of California at Santa Barbara. Nicole Knight, MBA, Student Loan Specialist and Financial Advisor. Over the last 20 years, Nicole has worked as the VP of Repayment Solutions for Sallie Mae and as a subject matter expert for the Association of American Medical Colleges. At the AAMC, she conducted countless webinars and lectures for medical schools and teaching hospitals, giving physicians the tools and confidence needed to take control of their financial lives. Nicole shares this expertise with our clients, helping them navigate the world of student loans, PSLF, protection planning, including disability and life insurance, and overall financial management. Nicole holds an MBA from Florida State University and a BBA in marketing and a BBA in management from Abilene Christian University. Thank you all for joining. Let's get started.
All right. Thank you so much for that introduction. Alexa, it is great to be here. Thank you for inviting us to talk on one of our favorite subjects. I'm Dina Filosa. I'm the managing partner of Physician Planning Group, and I always like to begin with the end in mind. And by the end of our session, just so that you know, our intent is that your questions about student loans and how to navigate through it will be answered. Hopefully, we'll put your mind at ease to some of the things you've been wondering about. So that's what we're looking forward to kind of getting through this evening and making sure that your questions are all answered and you feel a comfort with your student loan program. And while we are dedicating this evening to student loans, we also want to hope that you get to know us a little bit better about some of the other services that we offer. And at the end of our session, we'll provide a way for you to connect with us if you'd like to learn a little bit more about our services like wealth management or comprehensive financial planning or protection planning. So with that, I know you did a great job of introducing us already. So we'll just head on to the next agenda and just kind of go through the items that we're going to be covering tonight and what we're expecting is on your mind already. And that is number one, how do you return to repayment? Even though probably repayment did start in the month of October, we're going to go into a little bit deeper. And what are the repayment plan options? There have been some changes that came out, some kind of relatively new things that are on the horizon. We're going to address those and answer any questions that you may have about that. And then lastly, when we work with, with physicians that are working in hospital settings, public service loan forgiveness is an important one that the questions always come up on. So we'll address that as well. And then we'll mention that as you have questions, as we go through it, we'll ask that you put it in the chat. And if it's a personal question, I might answer directly just to you. But if it's something that's important, we'll share with the group, and we'll bring that out. So with that, I'm going to let us get started. Nicole Knight will pick it up from here. Oh, can we hear Nicole?
Always double muted. I'm here. We are going to start where you all know this whole experience situation began, and that is with the CARES Act and really COVID, so the coronavirus. So this all dates back to March of 2020 when, COVID hit us hard and the pandemic began, and the CARES Act was put legislatively into effect. Now, the CARES Act was a huge body of legislation affecting many different areas, but one of those had to do with federal student loans. And so we are experiencing the end of the impact of the CARES Act on loans. So what was the experience? In the past 3.5 years, not half, 3 years and some months, what your loans went through was a freeze. And what got frozen? Two things got frozen: monthly payments and interest accrual. So you did not have to make any payments over the last 3 years and a few months, and no interest accrued during that same amount of time. So one thing I want to point out to you is if you did make payments toward your federal student loans during the last 3 years and a few months, you do have the ability and right to request to have that money given back to you. Now, who would do that? Those who are pursuing PSLF may be of mind to have that money taken, brought back to them, but it's not a common known right. So I just want to put that out there, that is an option because you didn't have to make those payments. Nonetheless, the end of the freeze is here. As of August expiring, interest is now accruing again come September. As of September 1st, interest started accruing on your loans, and repayment is now beginning for many. But a couple things that did not were not impacted by this freeze was your private loans. If you had private student loans, those were not impacted. So you did have to make payments to them for the last 3 years, as it did the Perkins loans that you might have borrowed along the way, and or any FFEL loans. These are older federal student loans. If you had any one of those in your student loan portfolio, private loans, Perkins loans, or FFEL loans, those did not get frozen. Payments were required and interest was not frozen. So I just want to be clear that not all loans went through this freeze that was brought on by the CARES Act, but if you did have direct loans, that's the key. Direct loans experienced the freeze on student loan payments and the freeze on interest rates. So just know what loans you have. And if you don't know, you can find that in your studentaid.gov account. That's really referred to as your FSA account. It's Federal Student Aid account, and that's at studentaid.gov. So there's where you will find a complete list of all of the loans that you borrowed. Just log into your account and you can see that. Now, one thing I want to tell you that did not get frozen during these last 3 years was time counting towards repayment. You see, your time in an IDR plan, which is an income-driven repayment plan, that time, these last 3 years and a few months, it counted. They counted that, they being the Department of Education, as time that you've spent working towards repayment. So you now have under your belt at least 3 years, or if not more, towards your IDR plan forgiveness, because each of those plans has a term, which is a limit on how long you'll have to pay. At the end of the term, there could be some forgiveness. And Another area that there is forgiveness in is PSLF, Public Service Loan Forgiveness. And that is another area that was not frozen, meaning time spent in repayment during these last 3 years and some months counted towards PSLF. So that's good story for you. But where we're at now is at the end of that freeze. Everything has unfrozen. Interest is now accruing. And so it's time to return to repayment. So with that, Seth, could you?
Sure. So you've probably been getting notices from your student loan servicer. You may not open all of those emails when they come. So we're going to recap some of that information that you might have received. The first thing that everybody should know is that the studentaid.gov website has a page dedicated to returning to repayment. If you go to studentaid.gov/restart, a lot of the information we're covering today will be summarized there. You can review it. You can try and figure out what applies specifically to you. The first principle to sort of keep in mind as repayment resumes is the timeline. The CARES Act payment pause ended August 31st. September 1st was the first day that your loans were no longer in the payment pause, which meant interest started to accrue again. But September was not a payment month. Per Department of Ed policy, September was allocated as an administrative forbearance month. This is not like if you requested forbearance during a repayment cycle previously or during residency if you couldn't afford a payment. This was Department of Ed giving the loan servicers time to use forbearance to get their ducks in a row, to make sure that people's repayment plans have been implemented, to make sure that a couple of the major changes that occurred during the CARES Act were in place. So in August or even in July, you might have received a notice about payment resuming in September, but you did not have a payment due in September. That was reversed or it never occurred for your account. October is intended to be the month that everyone returns to repayment. And most of you will see on your student loan servicer website or will have received by email or mail a bill for the October period. You should have a payment due in October. That payment should be based on the payment you had in place before the CARES Act payment pause started. So most likely for most borrowers, you may not have had an increase in your payment between March of 2020 and then the payment that's due for October of this year. Now, if you were in an income-driven repayment plan and you submitted an application during the CARES Act payment pause, if you provided proof of income with that application, they will have recalculated your payment based on that application. For some of you, that may have been higher income. For some of you, it may have been lower income. But if you asked to have your payment recalculated, they did. And it's going to be that most recently approved income-driven repayment that's going to come into play. I will add a new development that we've started to notice over the last couple of weeks, which is borrowers are starting to receive notices from their loan servicers that say there's going to be a longer administrative forbearance. It was supposed to just be for October. Well, it turns out that the decision to return 45 million student loan borrowers to repayment in the same month was not great planning on the part of Department of Education. Not everybody's processing got done in time. So many loan servicers are implementing an extended administrative forbearance through November as well. If you get a letter that says you've got that extended forbearance, you may have some choices about whether to take it or not. But just so you know, if you get that letter, it's not an error. They are assuming that they need more time to get their ducks in a row. You can then reach out to your servicer to decide on your approach based on that. You should have received a bill again at least 21 days prior to a due date. Check your loan servicer website. If you had been getting paper bills before and you didn't see anything show up, maybe something's just lost in the mail, but go on to your loan servicer website. You can identify your loan servicer also at studentaid.gov to get that information. So things to sort of, make your checklist. Go on your loan servicer website and or studentaid.gov and make sure that they have accurate contact information for you. I believe one of our medical schools closed all of the student email addresses for previous graduates this past year. If you've been riding on an email address from your residency, but you don't work there anymore, you got to make sure your loan servicer has that contact information now. Take a look at the payment that your loan servicer is showing due for you in October. If that's not affordable, if you were in a standard repayment plan before and you've got 2 more kids today and you want to lower that payment, take a look at whether one of the income-driven repayment plans can reduce that payment. There is a resource on the studentaid.gov website as well where you can run a loan simulation and you can look at different repayment options. If you are on an income-driven repayment plan, so if you were in the pay-as-you-earn or the IBR plan or the revised pay-as-you-earn plan before the payment pause went into effect, and you have had a reduction in income or an increase in family size, you can choose to recertify now. It is not required. You can take your old payment back and continue on as you were, or you can submit new information to have your payment recalculated lower. If your income has gone up and you're a borrower who's trying to engineer loan forgiveness, or you just need room in your budget, you don't have to give new information and have your payment increase. You can stick with the old payment. If you want to recalculate your payment strategically, then you would submit an application. That is also done through studentaid.gov. There's a couple more checklist items as we go forward. Automatic payments. We encourage everybody we work with, sign up for auto debit. Don't leave this up to you remembering in the midst of your busy life and your call schedule and your moonlighting and your family. Don't try to remember to pay this bill. You don't need to go to the bank and take them a check here. Set up auto debit, sign up on your loan servicer website. Auto debit is not through studentaid.gov. It is through your individual loan servicer company's website, but sign up for automatic payments. If you were enrolled in auto debit before the payment pause started, if you go to your loan servicer website, it might say initially that you're still enrolled in auto debit. Most likely the bank account authorization did not transfer. So you need to go back and sign up again, or at least validate a bank account again. So double check that information. There is also a 0.25% interest rate reduction associated with signing up with auto debit. So if you're somebody who is in private practice and you're paying off these loans yourself, you want every bit of interest reduction you can get that auto debit in place. You do not have to recalculate your payment to sign up for auto debit. Make sure you understand what your monthly payment is. Make sure you understand when it's due. Again, your loan servicer website is the resource for that. Make your payment on time. Sign up for auto debit. If you don't sign up for auto debit until the day your payment's due, you better make an annual payment this first time. They're not going to process it the last day. As far as who is your loan servicer, the place to find that out is studentaid.gov. You will be able to see all of your loan portfolio and your loan summary information when you first log into your dashboard. The loan servicer information is on the right side of that screen. I mirrored here in Zoom, so you're seeing my hand on the wrong side. But on the right side of the screen on your dashboard at studentaid.gov, it shows you who your servicer is. Link to the website from there. Make sure you're not doing anything that exposes you identity theft. That's how you can make sure that you've got the right company. So the strategic question for a lot of borrowers is this idea of, should I recertify? I'm entitled to my old payment from March of 2020, but should I change and recalculate my payment now? So there's a couple of things you might want to consider. Number one, as I mentioned, has your family size changed or has your income dropped? If you're trying to minimize payments for a loan forgiveness or a budgeting strategy, yeah, you probably want to recertify. The other question will come down to which repayment plan you're in. And I'm going to let Nicole cover that when she goes over the individual payment plans. But even if you were an income-driven repayment, the plan that you were in before the payment pause may not still be the best option. So you want to take a look at what you owe, when it's due, and see if there's a better option there for you. Nicole, you want to start to walk us through the plans?
I do. So the student loan repayment plans that Seth is referring to, I'll just start off by saying that federal student loans offer the most flexibility, meaning that you get to choose to an extent how you pay and when you pay, because the Department of Education is giving you a plethora of options. And so I want you to know, if you want to postpone payments, even beyond this moment and the fact that you are being put in an administrative forbearance, for whatever reason that you may need to delay the start of payment or in the future need to delay payment, that can be done. Just work with your loan servicers and they can absolutely help you. On the other hand, if you are paying loans, you have the ability to choose which repayment plan you pay under. And the plan you choose will determine how much you pay. And I'll break up the options of the plans into two categories. One is called traditional. And so these plans are very much dictated by, as far as the payment amount goes, how much you borrowed, but they will tell you, if you do standard, you have a 10-year time frame. in which you will repay all of the monies you borrowed. Extended is 25 years, and graduated is actually 10 years, but they do give you a lower payment for the first 2 years. But come year 3, it will jump up higher than the 10-year standard payment amount. So these are traditional plans that ultimately result in you will repay the entire balance of your debt by the end of the term, whether it be 10 years or 25 years. But these are traditional plans. These also can be very expensive plans as far as on a monthly basis. And so income-driven repayment plans have been introduced. This is most helpful for those in training, especially, but still have a place for those after training is over, especially if you're pursuing PSLF, the Public Service Loan Forgiveness. And so what are these options? They include the ICR plan, which is 20% of your, the 20% not of your income, it's your discretionary income. Then there's 15%, which is the IBR plan of your discretionary income, and Pay As You Earn offers a 10% of your discretionary income. And now the newest plan you see at the very bottom is called SAVE, Saving on a Valuable Education. This is also a 10% of discretionary income, yet the formula for discretionary income has been updated, making that payment amount a bit lower than Pay As You Earn. And so SAVE can be the lowest costing repayment plan available to us yet. So SAVE does exactly what its name says, potentially. With that being said, the question is, well, should I go into SAVE or Pay? And I just want to be clear that as you are entering into active repayment under your previous repayment plan, if you were in Repay, they have sunset Repay. It is no longer an option. You will now be in the SAVE plan. You are, in fact, now in the SAVE plan. You will see that when you log into your account through your servicer. So just know that that is happening and it cannot be undone. On the other hand, if you were in Pay prior to this, you are still in Pay. So take a look and see where you're at right now. And I will just say that you have flexibility for a time to make a switch between the two, but we're going to talk about when that flexibility ends, because it will end. But before telling you about that end of flexibility in regards to switching between SAVE and Pay, I'll expand on this newest plan. This is an exciting plan, this Saving on a Valuable Education plan, SAVE, because it not only replaced Repay, it also improved some of the conditions of Repay, meaning that it lowered the monthly payment calculation. As I said before, the income calculation is a little bit more in your favor in that it will cost you less. The SAVE plan also increased the subsidy, meaning that as interest accrues, if you do not repay all of it, the SAVE plan will 100% subsidize all of the unpaid interest on a monthly basis. So if your required payment, as an example, I'm just using general numbers, if your required payment is $100, but $500 of interest accrued, $400 is going to be subsidized. You'll pay your $100 and the remaining amount will be subsidized, meaning it will be wiped away. So your debt level will not grow because of accruing interest. This is fabulous because it means no more negative amortization inside of your loans if you are in the SAVE plan. Now, the SAVE plan also brought with it the unique factor that the Repay plan did not have, and that is the ability to file married filing separate. So that's very key for some of you pursuing PSLF who are also married to income producers. So your spouse is working and has a job. You may choose to file married filing separate, and that is an option in the SAVE plan. Now, negative for the SAVE plan is that there is no maximum payment. As your income goes up, your payment amount will go up. There is no cap under the SAVE plan. So just be aware of that, but also know that all the time you spend in the SAVE plan will qualify as a qualifying payment and qualifying time towards PSLF. So that is great news for those seeking public service loan forgiveness. Now, alternatively, for those of you that might not be aware of the details of Pay, it's similar to a degree as the SAVE plan we just saw, but like I said previously, they are drawing this plan to an end. After July 1st of 2024, you will no longer be able to apply to get into it. So I just want you to know this is a limited time that you can get into pay if you're not already in. However, once you're in pay, or if you get in prior to July 1st, you will not get kicked out. They just won't let anybody new in after July 1st of 2024. Now, to get into pay, though, I want to be clear, it's not as simple as just asking and you get in. You do have to meet some eligibility. Primarily, you do have to show a partial financial hardship. And so to make that simple, there is a formula, but I like to use this, this explanation that probably makes it most clear. If your debt level is greater than your income level, you show a PFH. But if your income is greater than your debt level, your student loan debt, then you likely don't show a PFH. So you have to review your own income levels versus your student loan debt and draw that correlation. But of course, your servicer can absolutely help you answer that question if you do or don't have a PFH. But you do have to show one to get into pay. You don't have to show one forever. You just have to show one on day one to get into pay. Now, existing borrowers in pay, like I said, they will stay in pay. But while there are no subsidies. So as interest is accruing, that example I just gave you, the $500 of accrued interest, and you paid 100 of it, but 400 was remaining, you will be responsible for that 400. There are no subsidies. There is no free money in the form of a subsidy in pay as you earn. So just be aware of that, because that could end up costing you more in the long run if you don't reach PSLF, Public Service Loan Forgiveness. Now, pay as you earn does also offer the ability to file married filing separate. And the wonderful thing about pay as you earn that's different than save is that there is a maximum payment. As your income goes up, because remember, pay and save are income-driven repayment plans, IDR. As your income goes up, your payment amounts will go up, but only to an extent in the pay plan, because once that you hit the 10-year standard payment amount that you would have had to pay on your loans when you started the pay plan, then that is the cap. Once you hit your cap, the servicer will not ask you to pay anymore. So your income goes up and up and up, and potentially the servicer could ask you to pay a lot more. But if you hit that cap along the way, they won't ask you to pay more. And what does that mean? It means that your cost could be less, and it could mean that your forgiveness amount could be more if you're pursuing PSLF. So in that regard, pay as you earn and PSLF work very nicely together, especially for those very high income earners in the later years. Now, finally, of course, as I said, PSLF, this pay plan is a qualifying plan for PSLF. Now, recertification, Seth touched on it very clearly. And so I think you know when you will need to recertify. Of course, in the next 6 months, for most, they're looking at last year's taxes. So that will not be necessary unless you do fall into the category Seth has highlighted as being maybe beneficial to you to recertify. So just look at your situation, decide accordingly. But other things you might want to review in your analysis of your current situation is if filing an extension may help you get a lower monthly payment for another year, because that is an option. So just want you to think about that as a consideration as you move forward. And also think about your marital status when filing taxes, because that can have a very big impact on what you're required to pay. So marital status is a big deal from here on out. So be aware of that and strategically decide each year how to file your taxes. Now, with that being said, there is a fabulous resource on top of the Department of Education who will offer a calculator that is generally helpful. It's not specific for physicians. Rather, the AAMC has created this fantastic tool called the MLOC, the MedLoans Organizer and Calculator. And the MLOC is one of the best resources to determine what you would pay on your loans with where you're at in your professional career based on your income. So I highly encourage you to access the MLOC, though I will tell you, as of right now, the MLOC does not have save built into it. That version of the calculator, that update, is expected in January. So the MLOC is a great resource that will show you your pay as you earn payments, but it's not going to show us save payments until January. So nonetheless, know this is a resource that was made especially for you, and I would encourage you to utilize it as you're making these future decisions on how to manage your loans.
So kind of bringing this back to, where are you trying to get to? Are you trying to pay off your loans as quickly as possible? Are you trying to pay as little as possible so you can save for college for children? Or are you trying to minimize what you pay for something like the Public Service Loan Forgiveness Program? This is a common goal for a lot of physicians. New York is one of the markets where the majority of physicians have the opportunity to work for nonprofit employers. We have large nonprofit health systems like the Northwell system or the Sinai system that own a lot of outpatient practices in multiple specialties. So if you're working for a qualifying employer and you have the right kind of loans and you enter the right kind of repayment plan, the Public Service Loan Forgiveness Program forgives your debt after you make 120 on-time monthly payments under those circumstances. Keys for this plan: you have to have direct loans. If any of you still have those old Ford Family Education loans from undergrad, the FFEL loans are not eligible for Public Service Loan Forgiveness. There's some steps you're going to need to take to consolidate those loans. And there's a timeline where you're going to want to get that done sooner than later so that you can qualify them for Public Service Loan Forgiveness. Eligible payments. The only plans that are eligible for Public Service Loan Forgiveness are income-driven repayment plans, pay as you earn or save, or the 10-year standard repayment plan on direct subsidized and unsubsidized loans. If you consolidate your loans and you've got a 25-year standard repayment on a consolidation loan, that's not a qualifying repayment plan because it's a 25-year, not a 10-year. So getting into income-driven repayment is probably going to be vital if you're pursuing Public Service Loan Forgiveness. Eligible employment. You have to be working for a nonprofit employer to qualify. And when we say working for, we mean who issues your paycheck. It is not a matter of do you work on site at a public hospital or a county hospital or a teaching institution. It's not a matter of whether you work in an outpatient office. There are circumstances where you might even own the building that you work in, but your employer that owns the practice could be one of these larger health systems. If your paycheck is issued by the health system that is a nonprofit entity, a 501c3 or any level of the government, that's going to be qualifying employment for Public Service Loan Forgiveness. If you work on site at Zucker, but you conduct anesthesia as an independent contractor who owns your own business, it doesn't matter that you're working at a nonprofit. You are not working for the nonprofit. The ways you can pursue this is there's an annual certification process for Public Service Loan Forgiveness. It's not required every year, but best practices are to make sure that you keep up with how many qualifying payments you've made. There is a PDF form that you can fill out and you can upload to your loan servicer. There is a new process for this that we strongly encourage everybody to follow, which is the PSLF help tool on the studentaid.gov website. If you've got your employer's tax ID number, like from your last year's W-2, and if you've got an email address of the person who's willing to sign off on the public service form for you at your job, use the PSLF help tool. That software will fill out your form, it will error check it, and then it will send it to your employer via DocuSign for electronic signature. What that process has eliminated is somebody not being able to read handwriting, which has been the biggest problem with processing Public Service Loan Forgiveness paperwork, or your employer filling out something incorrectly and putting the wrong start date for you, or a digit missing on a tax ID number. This kind of error-proofs the process. We're also seeing much faster approvals and certification of qualifying payments. Especially those of you, again, who are physicians who've been in practice and you're getting closer to that 120 payments, you probably want to know sooner than later that payments qualify. Use the PSLF help tool, do the online DocuSign process. It will go faster. Another important thing that you all may be starting to think about that maybe you didn't think about when you were residents or med students is if you get your loans forgiven, how does that affect your taxes? Well, public service loan forgiveness is a tax-free forgiveness of debt. IRS has signed off on this. If you work for a nonprofit employer and you make qualifying payments for 120 months, the amount that gets forgiven does not matter. You will not have to pay any income taxes on that. If your loans are forgiven through the income-driven repayment plan, maximum repayment term forgiveness, that is a taxable loan forgiveness event. So if you make your payments under pay-as-you-earn, working in private practice for 20 years, and you still have a balance at the end of 20 years, whatever's forgiven is going to be considered ordinary income in the year it's forgiven, and you will have taxes to pay on that amount. So public service, non-taxable, income-driven, maximum repayment, taxable. Keep those clear in your mind. If you're working for a nonprofit, you do not have to pay taxes on this benefit.
So let's look at the,
Let's see.
here's
Yeah,
an
go for it. Why
example
don't you walk
of,
us through some numbers?
here's an example of PSLF. So if we had Dr. Median, so we're looking at the median level of debt, that's for actually the last, what are we looking at? I think this year the median
200?
level of debt is 200,000. And so actually that's been the median level of debt for the last 5 years. But if 200,000, we had Dr. Median pursuing PSLF, they go into pediatrics, they spend 3 years in residency and then 7 years at a community health center. In total, they have spent 10 years working in public service, and they qualify for PSLF. Now, if they were making payments under the pay plan, you see they have, of course, spent a total of 10 years doing the work. They also were making payments under pay, which during residency, those payments are lower, but post-training, the payments are a little bit higher. And the total amount that would have been repaid would have been a little over 120,000, and the total amount forgiven under PSLF after 10 years is close to 200,000 at 194,000. Now, if it was paid under the SAVE plan, we're seeing similar numbers. The payments during post-training are a little bit lower. There's also that 100% subsidy that would have worked for this borrower, Dr. Median, during those 3 years of training. And so in sum, they paid less. They paid 112,000 towards their debt and had forgiven 195,000. So this is the impact of PSLF, coupling it with one of these IDR plans. Now, the primary, and Seth has already highlighted this very well, the primary employment opportunities to work in and pursue PSLF are going to be those government employers or the nonprofit hospitals or health systems. But he has given us a very good way to determine if we're on track for PSLF, the tax-free forgiveness, and that had to do with the PSLF form. But I will tell you that PSLF form is going to be critical in seeing if you qualify for this. This is a one-time adjustment that the Department of Education will make. It's called an IDR adjustment. The one-time payment adjustment that they will make is going to require that you, one, fill out a PSLF form. Remember, the help tool will do that for you at studentaid.gov. That's how you'll access the help tool. And then two, it will encourage the department to see if you have any months that would count. And I will just go back and highlight because some of you might fall into this category, that any month spent in any deferment, with the exception of in-school deferment prior to 2013, they could count. So there are many months in your past that could count, or any time in repayment or deferment or forbearance, if applicable, on earlier loans before consolidation. So this too is another realm where you might not have thought that those months were going to count, but they could. So I encourage you to fill out that PSLF form before this year is over so you can qualify for that IDR adjustment. Now, the PSLF form, easiest, as Seth said, is to fill out online using the PSLF help tool. And he already documented clearly accessing your employer's EIN, utilizing that, and then it's pretty much an easy process from there on. So use the PSLF help tool to help you get started in pursuing this.
Just a couple of real quick things on that PSLF help tool. Like I said, you want to make sure that you've got the employer's tax ID. You should also make sure you know who you're going to send this to at your employer, whether that's your, the chair of your department, or whether it's a house staff officer, or whether it's somebody at HR that you know. You want to know who it's going to, and you should probably give them the heads up that this email is going to be coming for DocuSign, because it comes from the Department of Ed's DocuSign server. It's going to be an anonymous email address. It's not going to come from your email. So you want to give them a heads up to expect this and make sure that they do read it, turn it around, get it done for you. But if they do, it's become the most efficient way to get this done. Let's see, there was one question that we had in the chat that I wanted to just share, because we've focused a lot on income-driven repayment, federal student loan repayment benefits, public service loan forgiveness. Some of you are trying to pay off the loan aggressively. Some of you are in private practice using your own resources, or you borrowed a nominal amount and you don't have $200,000 of student loan debt to manage. If you're paying the loans off yourself and you're looking to refinance the loans, our firm does not issue loans. We're not a bank. We do not offer refinancing through our firm. We are certainly aware of the tools of refinancing student loan debt. We are aware of the marketplace for people who do offer that. There's no one we specifically endorse. We would help our clients evaluate loan offers to see if something is suitable, is going to be beneficial. So there are other paths than what we talked about. The math on loan forgiveness after 10 years under income-driven repayment generally works out the best for most people, which kind of brings us to the idea of potentially meeting with you individually. Every time we do one of these education talks, we do offer consultations for individuals who attended. If you are interested in sitting with Nicole or I for a half hour, going over your loan portfolio, figuring out whether you are approaching this from the right angle, using the right strategy, checking off the right boxes, we'd be happy to spend some time with you to go over that. And in the consultation, we would review your loans with you. We'd also want to talk a little bit about your broader financial goals, get to know you. How does this loan repayment fit in with the other things that you're trying to get done? And then we would walk you through our process for how we might prioritize those goals and help you build a system to manage them. If you use the QR code in the slide, that'll take you to a sign-up form. You provide us with a little bit of information so we can prepare for a meeting, and then we would reach out to you by email to schedule a Zoom meeting to go over it yourselves. We like doing this stuff. This is a fun way to interact with the medical community. I can tell you that public service loan forgiveness is working. It is happening for physicians and other medical professionals. My wife had her loans forgiven after 10 years this past April. So it is real. It is happening. You can get it done. And if you're not pursuing a loan forgiveness strategy, there are still ways to make this as efficient as possible and make sure that you're balancing it with your other financial goals. So we encourage you to do that research, do that homework, or offer to spend some time with us and we can help you formulate a plan. If we have any other questions, feel free to drop them in the chat. If not, you're also able to email myself or Nicole directly. Again, thank you for your contribution to all of our wellness and your work in healthcare. This has been a heck of an era for physicians to be treating people through the COVID emergency and the stress test of the American healthcare system that you've all gone through. We take a lot of pride in trying to offer something back and help you through this process on the financial side. So hopefully we'll hear from some of you, or we may see you at a webinar in the future. Thank you and good luck.
I have a quick question while other people are thinking. So what is the most common error or, the most common mistake that you see when people approach paying their student loans?
The most common error used to be people had those old loans from the Ford Family Education Loan Program and they hadn't consolidated them. So they were pursuing something like loan forgiveness, but they did not have the right type of loans. I think that's starting to wane and people are getting the right information and they're making sure that their loans are organized as direct loans. Second to that, probably the most common one is forgetting to recertify an income-driven repayment plan. When you submit that form, you get a 12-month payment cycle and you're entitled to the same payment for 12 months. But if you don't check on your loans for 12 months, that payment's going to expire before you have a new payment calculated and back in place. So it's usually about 9 months into a 12-month payment cycle when your loan servicer is going to reach out to you and say it is time to recalculate your payment again. Some of you may have been through this where you have a month that you got to go back into forbearance while they recalculate a payment because you didn't get it done in time. So, we tell all of our clients to put a reminder in their calendar 9 months after they get a payment schedule approved. That reminder is going to tell them to proactively start looking for a renewal notice from their loan servicer. I have clients who set up their Google account, their Gmail account to automatically send me emails every year for the next 10 years based on that same date, so that they're partnering. They've got an accountability system. They've got some way, but late recertification has probably become the biggest problem that I'm seeing. How about you, Nicole?
I think that the hardest thing to get right out of the gate is picking the right repayment strategy.
Yeah.
But at this point, the Department of Education, because of taking pay away, has simplified the process, which I think was their goal. And so that's good, because now paralysis by analysis won't happen anymore. The SAVE plan is a great plan, and it is a great start in pursuit of PSLF for sure.
I'll add
You
one.
gave me a.
Oh, go ahead, Seth.
No, go ahead, Dina, please.
I was just gonna say, I mean, this is typical. I saw back in the day with younger physicians, they would be so intimidated by the amount of what they thought the payment would be, that they kind of just said, oh, I'm just not going to pay it. And they went into forbearance, which is okay.
Yeah.
But now there's really no reason why anyone should not make a payment, because it's, it really is designed to be affordable. So, for if you're kind of afraid of it, or you may know someone that's been hesitating about what are they going to do, they're really now they really have expanded the program to make it affordable for pretty much everybody.
Yeah.
Except
Well, I got reminded of something that I promised to talk about before, was this administrative forbearance extension that we're seeing, where it was just supposed to be September, and then you were supposed to be back in repayment in October. And we have seen with clients, people who got a bill for October, but then within the last 2 weeks, people have been getting letters that said, now there's an administrative forbearance on your loans that's going to go through October and November. If you're not ready to pay, that's fine. Take your administrative forbearance. It's not hurting your credit. Interest will accrue. It is a forbearance. It's not a deferment. There's no interest waiver. But if you're pursuing public service loan forgiveness, sitting in that forbearance is not helping you, right? It's just time. It's just your clock ticking. So if you want to get rid of that administrative forbearance, you've got to reach out to your loan servicer and let them know, I was already approved for the right repayment plan. You moved me from repay to save, or I'm in pay and I'm staying in pay. I have the right payment schedule, but then you sent me a letter that said I'm in forbearance. I do not want that. So here's the complicated part. With 45 million borrowers re-entering repayment, the phones are jammed up. Wait times can be as long as an hour to speak to somebody on the phone at loan servicers right now. Most of the loan servicers have an online messaging component. Start by submitting an online message. Include all the pertinent data, include that you had a payment, include the dates of any new notices that you've received after that payment was scheduled, and then let them know, I'm a PSLF borrower in an income-driven repayment plan. I do not want this forbearance. I want to resume payments as soon as possible. We've had some luck that route. It's been really hard to communicate with the loan servicers by phone right now, again, just because of the volume of calls and the volume of borrowers going through changes. So anything you can communicate in writing, do so. If you do ever call your loan servicers, you want to make sure you get the name of the person you spoke to. You want to try to get a written response from them that documents what you went over. Loan servicers are call centers. These are not banks. These are not even finance companies. You are not talking to people who are student loan experts for the most part. The first person who answers the phone is going to be a level 1 customer service rep, just like you were calling the cable company. So make sure you're armed with the right information. Make sure that you've got partners with the right information who can support you if needs be, and then make sure you document everything that you communicate with loan servicers as you try to make adjustments and correct issues on your loans.
Thank you. That was great. Are there any other questions that we have in the audience right now?
Going once, going twice. Well, thank you so much, Alexa, for having us on. Nice to meet you. We hope to work with you or hear from you. And if you have any questions, just shoot them out to Nicole or Seth.
Of course. Well, thank you guys so much for joining. This recording will be available via YouTube, and have a great night.
You too. Thank you.
Take care.
Thank
Bye.
you, everyone.
Thanks so much.